I saw this video yesterday where this person said, showed me this video where this girl said that there was, this show called Nia Nana. So this girl, there was,
On
yeah,
PJTV, is it?
yeah, this
Yeah.
girl was there, and she was saying that how her husband is sitting right next to her, and she was saying that, yes, my husband slaps me in the public. Yes, my husband sirpale and adipare, but still it's because he loves me so much, and that's why it's love, man, it's love. She was defending him, and then the host said, Gopinath, who never changes his quote, he said that, but it's like domestic violence, like why would you put up with something like that? And then she said, no, this is love. If he doesn't have the rights to beat me, then who has the rights to beat me?
I think in this case, there's a lot of cultural perspective here as well, right? Because generally, violence is a bit more tolerated by Indian wives, I think. I'm not sure why, but I mean, it's probably because there's always that kanavani kankanda devam kind of a
Yeah.
undertone to when you get married, right? Like, oh, your husband is the supreme and you're all dependent on the husband, and so whatever he does, he's right, and you just have
Yeah.
to take it and you cannot open your mouth. That kind of inculcation there is there. And still, I think in a lot of families back in India, in Tamil Nadu, is still the same way. But I think here it's a bit more different, I would say, because a lot of women, even Indian women, are working, like equally like contributing to the family, and so I think it's culturally is a little bit different here. I think the tolerance for this might be a bit lesser. But with that being said, um, there is also this pattern with people who are undergoing abuse where the abuser, right, does like abuses them and then comes back and apologizes and cries and say, oh, like, I cannot live without you, you're the only one for me, they tell you that sort of a thing. And then the next day the abuse continues again. So for the person being abused, they feel sucked into this cycle because they have feelings for the people who are doing this, right? You do love your spouse, right? So to a certain extent they might try and see if they can tolerate it because the spouse also comes back to apologize, but it stops there. The apology doesn't become a behavioral change.
Mm-hmm.
So we try and address this, especially in couples therapy. We try and address this a lot with the husband and wife. But the first priority for us will be to maintain their safety. So we have to make sure that the person being abused can maintain their safety. If they cannot maintain their safety, then we will have to activate um, other resources that's going to help them, depending on the risk assessment.
But what
Yep.
if
So
the woman doesn't think there's any problem?
So what we try to do is we try and find out why they feel that way. So is it because of cultural norms and beliefs? Is it because they are worried that, if let's say stopping the abuse means leaving their spouse and then they've got no other support, they have children and all of that, and then the spouse goes away, there's no monetary support, you
Yeah.
know, um,
And
or, if they
also,
feel, sometimes some people feel that, oh, I'm just meant to be abused.
yeah,
I'm
and
not meant to have a happy life.
yeah,
you
the
know
victim
like
syndrome.
they'll tell you like, oh, nala paavapata janmo, these kind of phrases, right? Yeah. So these are negative core beliefs that needs to be addressed. But I think I do agree with you to say that it's very hard. Firstly, I don't think they'll even come for treatment if they
Yeah,
feel that,
it's not even
oh, this is what I
abuse.
deserve, this is it. Yeah. But what we try and do is we want to make sure, especially if there's children in the family, that the children are safe. And if we can activate any community-based resources to help them maintain their safety.
Yeah, but I also feel, right, like I'm not I'm when I saw that video, right, I was not as shocked as a lot of people, because I feel like it's something that you grew up with, like even during that Arjun Reddy thing going on, when the director said that some people feel like such things, slapping in a relationship, is okay, and some people do not approve of it. And it's also how you are brought up. Maybe you have seen your father and your mother behaving in such a way where your father slaps your mother, and you feel like, yeah, but he provides for the family, he's fine, they love each other, they've stayed together for until they died, so there's nothing wrong in that. So it's also about how you brought up. Do you do therapies for people who are sexually abused?
Yeah, we do have trauma clients.
Oh, okay. So when you go to your job, so how do you deal with so many clients with so many different problems? I mean, do you like specialize in certain things?
Well, I do have a special interest.
Okay.
My special interest is people with like chronic medical conditions or neuropsychiatric conditions like ADHD, autism, mood problems following brain injury, mood problems following chronic illness. So that's my special interest. But as clinical psychologists, we are trained to treat the whole spectrum of mental health conditions.
Oh, okay. So
So be it depression, anxiety, trauma, all of that. So we do, I would say we do develop special interests, and we do go for like additional training in certain things. But yeah, I mean, fundamentally, like we do try and treat most of the psychiatric disorders there is as well.
let me just make it very clear. You are not that person who you see in movies when there's suddenly a problem with the heroine, they lie down on the sofa and then they start talking to the heroine. You're not that person, right?
No. Yeah, I don't have a sofa in my office. I do have a comfortable chair where they sit and talk to me and maybe recline a little bit. Yeah.
Okay. So that's what a psychiatrist will do. Will come in with his pen,
No,
listen to
most
the person.
psychiatrists don't have couch in there. They don't let people lie down, and psychiatrists, at least in the public system, the patient turnover is very fast, and like 10, 15 minutes, 10, 15 minutes, you know. So if you get your psychiatrist's attention for like half an hour is a luxury. It's like that.
Oh my goodness.
Um,
ஐயோ எப்படி
yeah.
படத்துல எவ்வளவு ஏமாத்துறாங்க பாரு.
Yeah. Tamil Padangal, I think they put out a very romanticized version of what a psychologist or a therapist might be. It troubles me greatly when people watch this and that's how they form their impressions of what we do.
Yeah.
But let me tell you, it cannot be more different
But
than
is
day
there
and night.
any Hollywood movie or a Bollywood movie or a Tollywood movie that has shown what a psychologist do properly? Any movie?
I think, okay, movies don't come to mind, but there is a series called 13 Reasons Why.
Uh-huh.
It's on Netflix. So 13 Reasons Why, the last season, I was watching it recently, so that's why it's right on the top of my mind. But that one, there is a therapist, so a proper like psychologist who talks to one of the very disturbed individuals in that series. And I feel that that portrayal is actually quite accurate. So the way in which they talk about it, even the language they use is quite accurate.
Oh,
Yeah.
okay.
So that one recently of late, that's the one that I've watched. But again, 13 Reasons Why is from what I know of the background, it's a very specific series that was done to raise awareness about mental health difficulties, about abuse, bullying, you know, all of these things in high school settings in the
Yeah.
US. I think the main point that I would like to make is that if you're looking out for information, make sure your information is coming from a credible source. Because I feel that people maybe like they read off some random website or, you know, like some WhatsApp forward, and then they form their impressions around that. So I would say please look out for credible sources of information. So talk to people in the healthcare field. You know, even a general practitioner, right? Your normal GP doctor would have good information for you with regards to, you know, mental health and what's going on. So biggest thing is please make sure if you're getting your information, and don't try to self-diagnose as well, because when you Google your symptoms, right, even if you Google things like crying, consistently. It can lead you to feel like, oh, you're the most like basket case, got no hope, that kind of thing, when you just Google, right? So don't use Google as your doctor. It's not Dr. Google. Okay, so talk to credible sources and get your information from credible sources.
Couple of months ago, I was having some problems with my scalp, and because it was like my scalp was like on aircon like that, it was like always cold, like literally. Then I googled it, and they said that these are symptoms of brain tumor. And I'm like, killing the poor. So, and I'm like, so that's how. And I went to the GP, and he was like, "Huh, did you like put some shampoo with some alcohol inside?" And I said, "I don't know." He said, "Yeah, 2 3 days it will be gone." And then he gave me his want to look. But the thing is, and then I told him I heard that it could be a sign of brain tumor, and then he gave me another want to look. So like what you just said is that get information, because nowadays people see someone like a celebrity, like paparazzi picture of someone like looking overweight and then wearing a face mask, wearing a cap low. Oh, look at this person, overweight, depressed, and everything. They themselves, the media will diagnose them.
Yeah, get your information from credible sources. And okay, so you talked about the kevalamana look that the GP is giving, right? So the thing about mental health professionals, right, be it counselors, social workers, psychologists, psychiatrists, anybody, we are all trained to be in a neutral, non-judgmental position when we deal with you. So feel free to seek help, because nobody's going to judge you for seeking help.
Yeah. Okay, thank you so much, Vithiyah. I'll end the meeting right now.
Okay, thank you very much for having me.
Thank you. Bye.